And I met my now husband, and he is a serial entrepreneur. And he saw what I was doing, and he said, you are, first of all, insanely busy. It's too much, right? You cannot possibly be a good wife, a good mother, and a good doctor with all of this. It's not practical nor possible. Someone's going to suffer,
Yeah.
which, I didn't want. And separately, he said, have you ever thought about, and I had started a business, obviously, but he said, have you ever thought about how many more people you could help if you started thinking about how software could help your patients? And, the truth is, I had already worked with some software. I was also the first doctor in my community to install an electronic medical record system.
Oh
Not
my
to age
gosh.
myself, but, that
Wow.
no one in my community was doing these things. So I had, learned a lot of different software types, EMRs, QuickBooks, trying to make an office paperless and wireless and faxless. 20 years ago, that was not a small feat, right? Everyone thought I
Hmm.
was crazy. But I had been doing that. And when I met Nick and he asked me to consider using software to improve patient outcomes, I had to really do a heart to heart to think, I am a little bit of a tech savvy person, but am I capable of scaling a business through software? And I kind of blew him off for a while. I ignored him for a while and I kept being very busy and seeing my patients. And then we started to make a family, which for us was disastrous. It was, plagued with infertility and loss, and it was just an awful
Hey,
experience. And more terribly, and I'm ashamed to say, it was really a letdown by my own people. I had doctors letting me down left and right,
baby.
malpractice, and it was just terrible. It was a terrible experience. And when we finally started to have some success in the department of having children, we had constant complications. All of my children were born in NICUs. I nearly died. The anesthesia didn't work. You name it, I had the problem, right? And it went on and on. I'm leaving half of it off the podcast, right? I don't want to ruin anyone's. But I one night had to take one of my sons to an emergency room because a physician at 5 o'clock on Friday told me, I'm closed. Sorry, I can't help you. Right. So I took my son to an ER. He had very high fever. I was freaking out. And we waited about 8 hours to see a
Jeez.
doctor, which is absurd in Los Angeles. And when I finally saw the doctor, who happened to be a friend, he said, Renee, you are a doctor. What are you doing here? Right? You know medicine. Why would you wait here? And I said, well, look, I want to be a mom. I don't want to be a doctor. And I don't want to miss something on my newborn who's a preemie, who's, sick, right? I don't want to do that. So in the end, on the way home, I turned to Nick and I said, here's what I'm willing to do, right? I'm willing to have you build me an app. Nick is an engineer. And I want to turn on and off like an Uber driver. And I want you to be my medical assistant. And we will see patients in our community, right? I'll do house calls. And that way, because I can turn on and off, I will be able to dedicate time to our family and appropriate time with our patients. And I won't stress out so much. And that's actually a hilarious story because I thought I was very stressed when I had made that decision to go into software. That company turned into Heal, which spanned 13 states, 300,000 house calls, in network with more than 25 insurance companies, had
Oh
$200
my
million
gosh.
dollars in venture capital. We grew it into something wonderful. We had, this was 8 years ago now. We had one touch telemedicine, we had remote monitoring devices. We were seeing children, seniors. We were delivering on, this notion of value based care. It was a wonderful, wonderful company that is now being acquired actually by Humana, a Medicare Advantage plan. So that's the sort of the very long story of
So you
how
are way ahead of the curve there.
way ahead of its time, Heal, way ahead of its time. Very difficult to fund, very difficult to get, people to invest in because rich people already have their doctor on speed dial doing house calls. Why should everybody have it, right? So very, very ahead of its time. In the last 2 years after that experience, I left to start something new with Nick. He named the company Renee. I'm strategy officer, and Renee is a health assistant. No, nothing but software, not a medical practice. I don't have doctors working for me, and we're not delivering house calls. So a very different experience this time